again, because this is a different Zoom. Give you a little time for that. I did send that mass email out, so they want to know to come on back. Come on back. So we will look at where we're at and where we're actually going. So as usual, the last class takes their exam on Friday. So we do have to wait until Friday for them to finish and also for the exam analysis to take place. As same for exam one, we will make the announcement when the grades are available. So you will receive that announcement. It will be in the announcement section. Okay. So as always, these sessions are recorded. They are reviewed by the attendance administrators. If you need to step away from the camera, if we're not on break, just put a message in the chat to myself. I'll send it out to everyone as, to the reason why you're not on camera. So let me share my screen here and let's pull up let's see where we are at. So remember, week 12, we meet, and that's for all of your classes to review. We usually look at your HESI scores, and then, of course, is a requirement for attendance. Even though we're here at the end, you still want to log in and meet that requirement. We're usually not together long. HESI's week 11. So most of you all are in several classes. So just make sure that if you have not, and they're campus specific, if you have not heard from your campus team for sure by the beginning of week 10, but usually week 9, they should be telling us, you should be informed about what day and time your HESI will be on your campus. Generally, HESIs are not given this time of night. So you remember I told you your week 11 might look a little bit different. They may start giving them this time of night. Really, I don't have that information, but usually they don't. So just, you have work, school, all your responsibilities. So just make a note, put a star or something there for week 11, that it might, your timing, and then also we have seen in the past, like you have a class on a Monday for the HESI, it might be that Friday. So, but nevertheless, you'll get that information. I just say that so that you can be informed, be thinking about what your week 11 is going to look like. And then, let's see, we are in week 6. We've taken the exam 2. So make sure that you're going back and hold on. Yep. Going back to week 1. This is for all of your courses and looking at that information. The HESI is it could be any of those concepts and as in depth about that concept as the HESI wants to be. So make sure that you're looking back over your material, making sure that you have that strong foundation of understanding of the concept. So when you have that question, no matter how it's asked about that concept, you're still able to answer correctly. So we just took unit exam 2. We talked about weeks 11 and 12. And then, so next week, well, we'll actually start today, but for sure next week we will finish healthcare financing. Like we talked about who's delivering the care. Now we're talking about the economics, the policies that guide how we pay for the services and the services that people receive, how they're paid for. So we'll start looking at that. And you do have this lesson activity and this adaptive quiz. Remember, you all, every point matters, making sure that you complete these activities. Don't let it be that you're not completing these activities, you all. Make sure you're completing them with your best score. And then week 8, we will finish up. We'll recap week 7, the content, just to make sure. We add in a few theories. There are not that many that we really hone in on, but there's numerous of theories out there. But we will look at nursing theory and research and that more at that evidence base. We'll look at that. And then week 9 is when we take the last exam. And then week 10, we'll let you all have the floor that day. And we will look at your you all will present your projects, your PowerPoints. And remember, for this, everyone turns in the exact same product. If there were 5 of us in the group and one person did, the first 2 slides, one person did 5 slides, one person did 1 slide. It doesn't matter. We put it all together. Everyone turns in that same PowerPoint. And then week 11, of course, is the HIS. We already talked about that. And then week 10 too, after you all finish with the presentations, or we may do it before, not really sure how we'll do it, but we'll go back over and recap information for the term in week 10 also, in addition to you are presenting your projects. So good evening again for everyone. This is week 6. Make sure you put your name and campus back in the chat. The homework grades are on. And as we said, they do change. Remember, remember the requirement. I think I put that in the announcement. Let me just make sure I pull that up. So you want to make sure you almost here at the end. Just keep going. Keep identifying those things that you've done, those study tips, and that whatever that you're using to make sure that you understand the concepts. Keep those tools, and hopefully you can add more to them as you all conversate and as we continue to review the content. So homework grades are on. What does that mean? And this is an announcement section. Your total grade in Canvas will reflect, both, and this is just a reminder, both your KGA average and the homework that grade combined. Okay, you will be able to see your homework, how it affects your overall grade. To successfully pass the course, you must achieve that 78% on your key graded assignments. That was that score that you had before we turned the homework grades on. Was that score at least 78% without rounding? So that's what this means. You must achieve that 78% outright, a minimum. And then also, once homework is turned on, that grade should also still be at least 78%. Okay. Homework will not be included in your final grade unless you have achieved at least 78% on those key graded assignments. When you have the HESI, that's part of your key graded assignment, unit exams. So refer back to your syllabus so you can see what those key graded assignments were. But the score that you had before we made this announcement was that score at least 78%. All right. Remember, you can still fail the course if you do not do your homework, or you score poorly on that homework, or poorly on the HESI as well. And we're saying this just to bring things to your attention. So, we can't let up. You all have been doing really well. Keep doing it. Keep pushing. It's almost over. To successfully pass the course, you must achieve that 78% on your key graded assignments and at least a minimum of 78% on the overall course grade. All right. So that's there. Like I said, you can always refer back to your syllabus if you need to, and the orientation PowerPoint. All right. So we're going to go back to so let me just bring this to your attention as well. We have points to ponder. We did put 2 videos in there. And I think that's what we called it. Points to ponder. And it starts yes, I'm pulling it up now. Okay, so we are starting to talk about how we are paying for the health services that people are receiving. That's what we're getting ready to talk about. So in the announcement section, it is called Week 6 Points to Ponder. There are 2 videos here. So these kind of give you a different way of looking at the material. Of course, we're going to talk through it with our PowerPoints and group discussion, but these 2 videos are here for you. All right, so let's go here. So as healthcare professionals, we are signing up to be life learners. That's just part of it. Because remember, we want to be providing the latest, best evidence-based practices for our patients. We don't want to just be in there just doing things from years ago and it's not the latest best thing. Now, there are some things that that the evidence still shows what we did 10 years ago or 15 years ago still works. So, but nevertheless, the evidence still shows that it still works. But as healthcare professionals, we're signing up to be life learners. So what is that? It's ongoing education. It is unit-based training. It is setting specific training in the event that in your setting, for example, the long-term care setting, if you're one of those charge nurses, then you will have charge nurse training. They even have professional groups that you can join. You can also actually sit on your board. I know on our board here, we at least have one licensed practical nurse on the board of nursing. They have a board. And so, but with all of that, it's just ongoing education and updates, ongoing. As a student nurse transitions to the role of a nurse, there will be the need for autonomy with decision making and prioritization. Because remember what, after you finish your school here, you're gonna take that NCLEX, pass it first time, move on. You're gonna select your setting. Some of you all might even purchase your temporary license and so forth, but you're going to be transitioning from under the umbrella of having that preceptor, that mentor, that clinical instructor. It's going to be you. You are going to be it. You're going to be the nurse. And I say that to make you afraid, but with all of that, you're going to activate that knowledge that you have. So you're going to be, based on that, your knowledge and understanding, you're going to be guiding and providing that patient care. You are the decision maker. You're going to be determining what's a priority. Hey, this is a change in this patient because at handoff report, this patient blood pressure was, 120 over 80. Now is whatever. Or at handoff, this patient was alert orient times, 2, 3, whatever. But then there's a change. And the thing about it, you all, even though you're going to have your temporary license or your permanent license, no one knows everything. And it depends on the setting you're in, things changes, policy, procedure, until you get your routine and your understanding of all what it really means to have your team of patients. If there's a question, even 30 years in, 40 years in, if there's a question, we need to ask for verification from someone on the team that's more experienced than us. So that is okay. That is part of being that responsible nurse and seeking out assistance when you do have questions. Even if you want to just verify what you know is the correct thing to do, it's okay. We were the patient, the team, the healthcare facility, they rather you seek guidance just to ensure that you're providing that's correct care. Okay. And like I mentioned earlier, unfortunately, there in some settings, some of your colleagues, team workers, team members will ask you to do things that are not in your scope of practice. It's going to be you to say, hey, it's not in my scope of practice. I am not going to do this. So just because you're being asked to complete a task, and if it's against that facility policies and procedures, which shouldn't, which aligns with the Board of Nursing, the State Nurse Practice Act, is going to be you to speak up for yourself to say, hey, no, this is not for me to do. So we are going to, for about 7 minutes, we're going to push our breaks to the end. So we're going to still give you a break time, but we'll push it to the end. Let's just go ahead and go over some of this content here. So I'm going to put you in small groups, probably groups of 2 here. And in that group, you will discuss professionalism. Like, what is it? Like, if you were explaining or giving a seminar or a quick 2-minute soundbite on professionalism, what would you define it as? And give us an example of that. So again, I'm going to go ahead and put you in breakout rooms. And what are you going there to talk about? Professionalism, define it, tell us what it is. Like, are there components of it? Explain it, make it as simple as possible, and then provide an example. And then when you come back, you're going to share it to the group. So I'm going to go ahead and open the breakout room. It's going to mix you up here. Let's see. Can I make sure everyone's in a breakout room? Make sure you change your name, you all. I think you are in, and that name is not on the roster here. So check your screen name, make sure you're captured correctly. So check that, and then also put your name and campus in the chat. So what are we getting ready to do? We're ready to open up the breakout room to give you 7 minutes. You are discussing what professionalism is. Break it down, be able to tell us about it, talk to us about it, and then give an example. You can do like a scenario. Think back about your clinicals, your present work, because a lot of you already work in healthcare. Just or it didn't have to be a healthcare situation, but an example that describes professionalism. All right, we're gonna put my little timer on and go over to the breakout rooms. Professionalism, what is it? Give us an example. Be able to talk us through it when you come back. Accept the invitation, and we'll see you in 7 minutes. Everyone should be coming back in about 45 seconds, and we will hear from you all. Okay, I think we have everyone back. No, waiting on 3 more people. Okay. All righty. So the question was professionalism. What is it? Give us that definition. What, if we were talking to someone or describing what it is, making it understandable, and then give an example, then we're going to share out. So you all were in groups, and we're going to spin the wheel.
To sit this on. It's over here.
Hey, remember, you're not on mute. These sessions are recorded, so check your mics. Here we go. Let's see who's going to share out first. Well, how about that? Group number
I was in group 6. Oh.
Senior, Essence, Annette, Essence, and Sarithia, Miss Alexander. All right, let us hear from you.
So we spoke about professionalism, and we say that it's behaving in a responsible and respectful, ethical way while doing your job. In the nursing professional includes treating patients and co-worker with respect, protect patient privacy and confidentiality, be honest and accountable for your actions, arriving on time, and be prepared for your work while giving care, communicate appropriately. Also, professionalism has to do with your attire, how you adorn yourself while going to work.
Great. Anyone else from that group want to share it? Or was Miss Annette your spokesperson? Is that it?
Yes, that was it.
Right. Great. Thank you. That was great information. And sometimes we don't think about like being on time, or if we're late, to communicate, hey, we are going to be late. All that is part of it. So that's good examples. All righty. Let's hear from Miss Carter, Miss Nichols.
So I think that professionalism is like consistently demonstrating responsibility, respectfulness, ethical behavior, while also maintaining the standards of care and what's expected of you as a nurse in general, or like a coworker. And then I believe my partner was going to give the example because I loved hers.
Thanks. So I gave an example as far as like professionalism during conflict. If you hold yourself accountable in or during a conflict, I feel like that's a level of professionalism. Also, I mentioned like following dress code, your appearance, how you come to work, is another form of professionalism.
Okay, great. In the
And
midst
that's
of,
it.
okay, thank you for sharing out, you all. Even in the midst of conflict, we still maintain that professionalism, being respectful, allowing others to speak, you voicing your opinion as well, being assertive, not aggressive, assertive, being open to discussion, and wanting others to be open to discussion as well. Great, thank you all. Here we go. Let's see who it's going to be. Okay, group number 6 looks like. We find out who was group number 6. That was Miss Lee and Spellman.
We spoke about professionalism being respecting each other and your coworkers, having competence of your I was gonna say degree, but of your job. So basically knowing what you're doing, and if you don't know what you're doing, then having the accountability to speak up, um, arriving to work on time, and just looking professional.
Great. Get in that extra training if you don't, because especially if it's a skill that we've learned in clinical simulation, we've even probably performed it in clinical, but it depends on what setting you go in. Some skills you just don't use that often. And so, but that doesn't mean that you can't do it because it's on our to-do list, our state nurse practice act, and it comes up that day. Not that you're trying to get out of doing the task, but it's been so long. You might need someone there. Maybe need to review the policy, and all of that's part of being professional, so you can provide that best care, keeping you safe and the patient safe. All right. Was there anything else from that group? Was that it? Thank you all. Here we go. 4 more groups. Okay, number 7. All right. Miss Gore, Francis, and Miss Virginia. Miss Gore, Miss Francis, Miss Virginia.
I'll start with the definition. It's good judgment, honesty, polite conduct, correct uniform, being on time. Yeah, pretty much. And then one of the other girls was going to be
Example.
Um,
Okay.
yeah, the example would be, like for example, if a patient, I don't know, if a patient is upset or, angry about their procedure that they had, you just want to make sure you hold yourself professional at that time. That may be listening, have a listening ear. If it may be giving them comfort to have some type of understanding. Um, you never want to bash them or anything like that. Just make sure you're there for them and um, with grace and etiquette.
Great. Is that it from the group? Something that came to mind. Even though you're confident in, it depends on the situation, you all. Even if and it could be someone had just passed, so you have someone critical, there's a change in status, or if there's a meeting with the family member, even though you're confident in what in the process, the facilities, policies, and procedures, and what you're going to say, what came to mind is sometimes you have to still call in someone to be there as a witness. So don't forget that part. So, and then the other part about documenting whatever it is, all that entails professionals. That's what came to mind when you are discussing your examples and your definition. Sometimes you have to call in someone to be a witness to whatever is going on and to sign off. So that is okay as well. Thank you all for sharing. All right, you're down to the last 3. Good examples, good definitions. Okay, let's see. Who was number 3? Miss Rogers and Miss Lampkins. On you. Oh,
Um, so for professionalism, it means being responsible, respectful, trustworthy, having compassion, being competent and committed to giving safe and good quality patient care. Examples would be like being on time for work, treating everybody with respect, taking accountability, following the correct policies and procedures, uh, advocating for your patient, especially when you know some safety concern, staying calm under pressure, not arguing like at the nursing station and stuff like that.
great. Anything else from the group?
No.
Okay. something that came to mind and just left my head, you all. But when you said the the conflict part, something it'll come to me. I forgot what it was, but great information. If something stood out, I know what it was. So in the event that there's a policy or procedure that's in place, and you think that it warrants to be changed. First of all, let me back up. There's a reason why those policies and procedures, why you're having to do what you're doing inside of those facilities. Is a reason why they're saying, hey, and I think I gave this example early on, they're wanting people to sign in when they come to facilities. For example, some places around you have to actually manually sign in. Some places you have to actually sign in with the electronic system that they're using. And some is a mixture. Some you have to have that ID, and then they create this name tag for you. Whatever it is, a reason for that facility having that policy. It's not something they just making up, just wanting us to do to just burn up extra time. But also, we do know that their policies and procedures needs to be revised sometimes. So if you think that's what it needs to be, have that conversation. Don't just not follow the policy and procedure, because in the event that something happens, what is going to be the scale that they're going to use to determine if we did not follow what we should have? They're going to use whatever their policy and procedure was to use to gauge, hey, you did okay, or you just disregard our rules. So even if, because sometimes like, why are we having to do this? Why can't we do it this way? Have that conversation. Being professional is open to ask others to have the conversation, but be open enough to receive what they're saying is why you're doing it like that. And sometimes policies and procedures are changed, and sometimes they're not. It's just not the best thing for that facility and their settings. Great, you all. All right, so down to the last two, and let's see who is going to go. Let's see, group 5 looks like Miss Hairston, Miss Hunt. Let us hear from you.
Okay, so what I have is organization, being dependable. Like for example, when you're telling a patient to that you'll be back, make sure, like, even if you can't come back in that certain amount of time, just communicating effectively to let them know that, hey, I haven't forgotten about you, I'll be back. Patient confidentiality. um yeah, being respectful, showing up to work on time. Yeah, that's all I have.
Okay, anyone else from that group want to share anything else? All right, thank you so much. Even if you're running late, still inform that, hey, you're running late, or if you can't make it, don't be a no call, no show. Make sure we are communicating that to them. And all right, our last group, once you get that wheel, experience of that wheel spinning, Miss Diaz, Miss Davis. Let us hear from
My definition of professionalism would be knowing how to being able to conduct yourself in the workplace, being organized and having good communication skills, and being able to work with others. And my partner, we're going to do some examples.
Some examples are showing up on time, speaking kindly, dressing correctly or appropriate, and responding calmly or respectfully, even if there's a situation that could go wrong.
Great. Thank you all so much. Everyone did really, really well. So your presentation showed that you do have that understanding of what professionalism is. So it's good. So Remember, most is next gen. You have to know what professionalism is in order to be able to pick it out of the situations or scenarios. So that's a good way of prepping to make sure that you understand that concept. Professionalism involves being respectful, reliable, ethical, and accountable. It builds trust and promotes effective teamwork. And we're going to talk here about working on the best team, the best facility here in just a moment. Addressing issues, because issues will come up respectfully and privately, maintain dignity and promotes improvement without damaging trust. So that's with the coworkers, with the patients you're taking care of, and also the family members that you might have to conversate with also. So then we move on to professional development. Is a continuous, intentional process, you all, aimed at improving one's on practice, competence, and leadership. Remember, we're life learners, so we're trying to just continue to build on and better ourselves. The nurse decides it is an ongoing self-directed learning and skill enhancement throughout one's nursing career. So some examples would be, for example, if you're wanting to get a certification or just learn more about a certain topic or a skill that you all are performing. So put it on your professional development plan, attend the webinar, attend the conference, nevertheless gaining that more education and training about whatever it is, but it's individualized and it's just continuous process. Excuse me, many times this professional development plays hand in hand with at least your yearly evaluations, and where you can list those things and you can set that goal, and then you come back and evaluate and determine whether or not you have actually accomplished it. Okay. So I had those slides flipped. Life learners, a professional development plan shows proactive engagement in professional growth. So, you got your license. Nope, that's not it. It's a continual plan and actions that you are actually doing to the steps that you're taking to better to add to your skill set, whether or not that's soft skills. Like, for example, we do have like this leadership academy that's part of one of these projects. And so guess who's in the leadership academy? Mayors, commissioners, mayors, people that own businesses, nonprofits, for-profits. Like, well, wow, seems like they've arrived. No, it's a continual process because they want to make what they're doing even better. The skill that the service that they're providing, they want it to be the best. They want to be the better person as well. It allows for this professional development plan. It allows for specific setting of goals. And remember, they should be specific, measurable. This approach encourages self-reflection. So you can have that to look back at, like, wait a minute. Okay, I am accomplishing this right here. Okay, so that's good. And then you can identify whether or not you need to adjust yourself one way or the other, whether or not that's gaining more knowledge or even gaining more experience with whatever that plan that you decided for yourself. This approach encourages self-reflection and continuous improvement. It also demonstrates a long-term commitment to enhancing professional competence. There are programs, novice new nurse programs out there with preceptors and coaches, like beyond you getting your license, still depends on what settings you're in. There are a lot of them that have the new nurse programs. And so once you become not a new nurse, you may even become that preceptor or that coach in that facility. And it's just to help the nurses understand all the information that they have so they can process it and actually implement it and do it with like a team of patients and do it safe for themselves and the patients. So this ongoing training, we have regular unit-based in-services, and this is, overall for the facility. And sometimes depending on that unit that you're working on, it's going to be specific to the task that you all actually complete on your unit as well. If that unit uses special equipment, they got a new piece of equipment there, that training might be about that. These trainings often address current issues and skills relevant to that specific clinical area. Frequent engagement, and they usually have these things often, at least once a month. Now, they have some in person. They may have some webinars that's pre-recorded. They may even have what they call lunch and learns. And so they're being different formats, but nevertheless, it is specific targeted information about issues or skills that's relevant to the care that you're going to be given. So the unit-based trainings allow for the immediate application of new knowledge to the practice. Okay. Consider the best care being provided. Consider the best job. Consider the best healthcare team. So just envision that you have all of this in one space. Okay. What factors or factor would promote this? What do you think would have to be present in order for this to be the best care provided to the patient? This one setting is the best of everything. You know, I love this job. I love my coworkers. I love providing this care for our patients. We understand what it is to take care of these patients. We understand what it is to call upon others or bring in extra help if needed. What factors promotes this? What do you think? And just kind of think about it. Shared governance. This improves the quality of care. It increases job satisfaction and promotes greater engagement and control over the nursing practice. So shared governance is viewed as an essential component of professional practice and is crucial for improving future healthcare systems. And what they have seen is when we do this thing called shared governance, it's not this one person that runs the show or knows everything. When it's all these things are shared, it leads to the best care. The morale is up. The best care is implemented with the patients, even if they have to seek out outside resources or transfer that patient to a different facility, still, because of that shared governance, they are being proactive rather than reactive to things happening. They've identified risks, potential risks, and actual problems for the patient, as well as the staff. Successful implementation of shared governance model in nursing requires a foundation and collaborative councils at units, departments, and organizations. So that means it's not just one person or one or two people that's running the show. But within this shared governance, there are clearly defined roles and responsibilities. This helps everyone to understand their contribution and what everyone else's contribution is as well. It does require continuous education and leadership development for the nurses support to be effective in those activities that they're going to actually implement. So it's not like, you know, the person like we have right here, a top-down management style. It is everyone, it's like a more of a team approach. It's shared. And believe it or not, that people say that they like going to work. When you do see the shared governance being implemented, they talk about the morale at work, even the customers, the patients. They're if they have complaints or concerns, you know, they are not because you're going to have things that they're going to complain and have concerns about, but still that is even received or even given in a different vein, if you will. So decentralized management in shared governance, the traditional hierarchical management style shifts to one where managers facilitate rather than control. So everyone knows what their job task is. So the manager is there to just assist as needed. It's not specifically say, hey, you know, you are supposed to be doing this. Have you did this? But they're there to assist if needed, and also to develop that so that team member can be transformed. It's like more of that transformational leadership style when you use this shared governance. So the managers more facilitate rather than control. So empowerment. This model creates an environment that enhances job satisfaction. It also leads to that transformation because, you know, the new nurse is sought out and provided the assistance that they need. It's a safe setting, so they're not afraid to ask for help and understanding of the things and the skill set that they have. Because of that, it empowers that person on the healthcare team where, you know, even if something, they make a mistake, they're more forthcoming, they're more proactive with their activities rather than being reactive. So collaborative relationships. Again, shared governance encourages nurses to work together and collectively develop these partnerships. Identify if there are issues. Can we work through these issues? What are the issues? Clearly define what the issue is. So shared decision making, again, it is part of that shared governance, allowing nurses to actively participate in policy and practice decisions, because it is us that's implementing them, right? So why not have us at the table in that decision making so that our voices are heard? Like I said, in our state on the board of nursing, there's representatives there from all parts, all different individuals or entities of nurses. So why not? Because it's going to affect us, right? So why not have someone there that can, voice whatever it is. So official, we're going to change gears here now. So we're going to start to look at some of the official government agencies. Yes, if you have to step away, just put a message in the chat. So how are these official governmental agencies able to pay and assist with the care that's being provided? What is their role that they actually play? Some of these governmental agencies, they do have money. They provide their services because the funds are supported or given by the actual state itself. Some of the programs receives funds from the federal government as well. And if at a minimum, if we can, we want to prevent the disease process or the injury from ever happening. So that's the basis of it. But we do know that, things do happen. There are some chronic diseases, no matter, how much health education we provide, depends on, some diseases are, genetic. Some are based on, the environment and things like that. So, but nevertheless, if we can prevent that injury from ever happening in the first place, or that chronic disease from happening in the first place, that is our bottom line. Okay. So this is again just showing how, different programs, some are mandated, some are not. And then who pays for it? That's who subsidizes it. Some is from the state. And then we know back here a couple of years ago, and it might not have been a couple of years ago, maybe just a year or so ago, where states were allowed to decide whether or not they wanted to receive that money from the federal government. And states that did not, they couldn't afford to provide that resource for the people that live in their state. So that's how come you will see a person may say, hey, I live in this state and we have this resource. Person may say they live in this state and we don't have this resource available. So it's because the state didn't have the funds, but then they wouldn't receive the funds from the federal government to have it there as well. So again, like we just said, some things are federally funded and some are state funded. And again, they focus on disease prevention and wellness. If we can prevent it, yes. And so here, that disease prevention, you will see a lot of community-based services, and you all, you will, the faith-based nursing, they have all these different programs and things that you might, health fairs, and they call them all different kind of things now, but the basis of it is putting that information out there so we can prevent that disease. And then screening and detecting whether or not there's a disease or a injury that's secondary. So this slide right here just looks again at the different governmental agencies that kind of oversee the well-being of the healthcare, whether or not it's pay, whether or not it's keeping people safe at work, whether or not it is overall collecting data so that we can know what diseases are on the rise, so that we can go ahead and be proactive, whether or not it is ensuring that the products, the food that we are taking in, the medications, that they are safe for us to even use in the first place. So we'll go back here. So Centers for Medicare and Medicaid, or CMS, they're looking now at value-based purchasing, and we'll talk a little bit more about that. Value-based. So they're putting more on, let's look at the value that the healthcare team is providing in this facility. Well, how do they do that? How do they put value to something? We're going to talk about that. OSHA. preventing work-related injuries, illnesses or death. That's their primary responsibility. So, facilities are supposed to have all of these things in place so that we can be safe and not fall down, and injure ourselves or even die because we're at work. So OSHA's there. And you should see these signs posted in healthcare facilities. They have like phone numbers or hotlines to contact these different places. And then we have the Centers for Disease Control. They do research and also they collect that data. For example, I can remember, if there's a high rate of something, for example, tuberculosis, there's a high rate of active tuberculosis in a certain area. Remember, there are those reportable diseases, right? So that information is going somewhere. Someone and nurses work on those teams as well. They're looking at that data, they're collecting that data, and once it gets to be a certain number, because they have these numbers out there, or these formulas that they put in, and once it reaches that number, then they go in, they say, hey, we're seeing a high number of, so everyone know about what was the bacteria that was in, they said the lettuce or whatever. So that information was reported. Once it got to be a certain number, they had to let everybody know, hey, something's going on, we're trying to figure it out, we haven't figured it out yet, but then they eventually told us. And so I'm sure that the US FDA and also CDC were working hand in hand trying to figure out what is going on. And eventually they figured it out. And then so we have the Food and Drug Administration. So we know that's food and medicines, but then also the products, the medical devices that we use, they say, hey, this is safe for us to use, or they even can approve certain things, medical devices or medications. And depending on the data, the evidence, if it shows that this is not good, they will pull it from the market. Or they'll, continue to make it be available if it shows that it is working as it was intended and not causing harm to anyone. So we have not taken our break, so we will pause here and take our break, you all. Just remember, if you haven't placed your name in campus in the chat, please do so for this recording because it's a different recording. We will see you on next week. Grades should be posted here on Friday after the exam analysis. Have a good week. Have a good rest of the week, you all. See you next week.
Thanks. You too.
Thank you.